people in the U.S. have been infected with measles during the first 4 months of this year that have been infected in the past 18 years. Why is it happening? Why this increase?
You know, I think there's two things that are going on here. And as you know, Anderson, I just returned from Africa covering this Ebola story. And one of the things that reminds you of is that we live in a very global world where these pathogens can move around the world faster than ever before. And that's happening. I mean, many of these cases in the United States came from overseas initially. 17 of the cases, for example, from the Philippines. But the other issue here, and this is something we've talked about a lot, is that you have increasingly these large pockets of unvaccinated people who are not getting vaccinated, not getting their children vaccinated, and that's a real problem. It's a very contagious disease. If someone comes, brings it, in this case from another country, it gets spread very quickly in those pockets.
I mean, you're a doctor. Have you ever seen a patient with measles?
No, you know, Anderson, I was thinking about this. You and I have both seen a patient with measles, but it was not in this country. It was in Africa, back when we were working on a documentary a few years ago. As a doctor in the United States, I have not seen a patient with measles. We've made really good progress. But, you know, in other countries, obviously, you still see cases. In fact, take a look at a map quickly, Anderson, and you can get an idea of what it looks like around the world. And those places where you see the highest cases and the most number of cases, those are also, perhaps not surprisingly, the places where vaccinations are lowest.
And some of the symptoms, what do people look for? I mean, how dangerous are we finding that?
You know, it starts off in many ways as a viral illness. People get the fatigue, the fever, the headache. What is sort of characteristic about measles, and the one thing people often know, is you get this characteristic rash around your body. And it's these sort of almost pinpoint red rash. It can also affect your eyes and develop something known as conjunctivitis. Those are some of the outward symptoms. Where it can get really scary and life-threatening is when you start to develop infections of the lung and the brain. And even for people who recover after having developed an infection of the brain, it can be very debilitating. Their lives are just never the same.
If you get vaccinated as a child, though, you don't have to worry about the virus now, right?
The vaccine is very effective. What they are saying is that, you know, for adults who got vaccinated, you know, after 1956, it may be worthwhile at a future visit to make sure that you're still immunized. They can do a blood test and figure that out. But yeah, it's an effective vaccine. You know, Anderson, let me just point out that if you look at childhood vaccination programs overall, just over the last 20 years, they have prevented some 300 million illnesses in this country. 300 million.
Incredible.
Close to 1 million deaths prevented. We talk so much about the fact that we treat disease after it occurs. Everyone gives a lot of lip speak to prevention. The vaccines have worked. We have the data now to show that.
And also save billions of dollars in healthcare costs. So bottom line, I mean, you get your kids vaccinated. There's no reason not to vaccinate your kids.
Yeah, you know, I'm glad you asked that, because I think it's really important not to be equivocal on this. And you hear a lot of people sort of, well, I do this or I do that. Yeah, I got my kids vaccinated. I got them vaccinated on schedule. I have 3 young children who are 8, 6, and 4. And I say that because I read all the studies, I've looked at all this. You and I interviewed Dr. Wakefield together, who wrote this paper that caused such controversy and was subsequently dismissed. But with all that I know and all that I've researched, yeah, I chose to do this with my own children, and I think there's something important about that.